Number 3, can people with arthritis or any joint problem benefit from chiropractic? And this goes along with these other things that we've been talking about. Any kind of a misalignment in your joints is typically going to cause wear and tear excessively on the ends, typically. Sometimes it goes right down the middle, but most of the time it's on the ends. Just like your car being out of alignment causes wear and tear, extra wear and tear on the outsides of the tires, making them more weak. Bone, although it's hard, it's also soft. You know, it's a little bit of a combination there, so that when you have a joint that's out of alignment and you put the improper pressure on there, it just sort of molds it to the side. And that's where, when you get arthritis, people call them spurs, and it's just a massive amount of bone out there where the body has tried to stuff more bone in there to stabilize it, so it looks all gnarly. And that, obviously, if you've got a big spur here and the joint's here and you want it to move, it's not going to, because you've got a big knot of bone there. They can get sharp. They can tear and rip on muscle and tendons and ligaments. And that just leads to all kinds of trouble and all kinds of symptoms, as you can imagine. It'll also lead to symptoms of stiffness, of pain. You know what? It could even be some tingling and things like that as well. So, can those people benefit from chiropractic? We typically can't make spurs go away. I say typically because, you know, the body put it there, the body can take it away, but we're not going to be actually taking spurs away. However, we can make the joint work more proficiently. If we can make it work better, move better, then you're not going to see the symptoms that are associated with those spurs or with the arthritis. A lot of people will come in and say, well, I've got arthritis in my knees, I can't run. I'm like, well, you know, you're the people that need to be running. Here's a saying that goes around this office that you really need to know. Motion is lotion. So the people that can't run because they've got arthritis in the knees ought to be running. You know, so maybe you can't run. You need to bike. Bicycling really works those joints too, you know, and it takes the hard pressure off. If you're instead of banging those knees like crazy, you can bicycle for sure. I don't know, for some reason water polo came into mind. That's going to be working a lot of different joints with taking the pressure off. But keep in mind, motion is lotion, and as a chiropractor, we take the pressure off that joint so that it can then work better, work more efficiently.